Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Vanbergen.
Hello, and welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Vanbergen, and today I'm interviewing my friend and colleague, Dr. Laura Christensen. Laura has more than 30 years of experience providing acupuncture to all kinds of patients presenting with all kinds of problems. She was educated in acupuncture in the early 80s in Boston and finally began her acupuncture practice in 1991 after taking a side path to become educated as a psychologist and practicing as a psychotherapist for a few years. When she began helping people with acupuncture, she immediately realized that she needed much more training in order to meet the needs of today's modern people. She has sought training with most of the best-known acupuncture teachers in North America and has thoroughly tested all of their approaches and developed her own style of acupuncture based on an integration of major aspects of these styles, along with electroacupuncture using very specialized devices like our Avazzia Life microcurrent stimulators. She also is very interested in the question of what prevents the body from being able to heal itself, as we all know it should, right? And so she presently studies German auricular medicine and uses specialized acupuncture techniques to assist the body in finding its way back to self-healing. She has, over the years, also studied Chinese herbal medicine and nutrition and has a health coaching practice in which she assists people with transforming their gut health and restoring metabolic health through lifestyle modification and carefully chosen supplements. She enjoys working with today's complex patient and seeking new solutions for them as science reveals more and more tools that are helpful in this endeavor. In this episode, Laura and I discuss her background, as well as some success stories she's seen, and we describe the concept of meridians and what it is exactly that electroacupuncture does for the body to actually help it heal and restore itself to that normalcy. In addition, we also touch upon the all and ever-growing power of scalar energy and how she has witnessed it transform lives in her practice. All right, so without further ado, let's dive in. Hello, Laura. Welcome to the show.
Hi, Rob. Thanks for having me.
So I'm really excited. This year, we're doing a lot more interviews with people about microcurrent itself instead of just other disciplines on the podcast here. And I know, when we talked at our open house for the Santa Institute, we got so many requests for your slides and your presentation. So I just knew people wanted to hear more about this. And this is a great platform to do that. So what I'd like to do first is just kind of ask you to share a little bit about your background and how you kind of got to where you are today and what you're doing today.
Well, I am in my 33rd year of practice. And I did not ever go to acupuncture school in order to be an acupuncturist. I was only curious about what we now know as ethnomedicine. And when I finished acupuncture school, I went and got a counseling master's degree and worked as a therapist for several years. And then after a bad car accident, I came home to live with my parents, and somebody heard that I knew how to do acupuncture. And that was the beginning of this new phase. So during these years, I have experimented with acupuncture, trying to learn better and better and better how to help our complex modern patients. Most of the people that I see are very complexly ill. They have chronic problems. They haven't gotten the results they need from other people. So I'm the last ditch effort person. And so because of that, I've had to get myself trained in lots of different types of approaches of acupuncture. And I've kind of landed up in the electroacupuncture community because I think it really gives me the most tools to help these people. Plus, I'm really a techie girl and I love wires and stuff.
That's awesome. You mentioned kind of complex modern patients, and so there's a couple of pieces to that, right? Like on the one hand, we see a lot more disease now than I think we did maybe even 100 years ago, and the variations in which people have these diseases, and the complexities. You and I both seem to attract people that have very complex situations, and as you say, it's a last ditch effort. They've tried everything that Google told them to try or that their doctor
Yes.
told them to try. So when you work with these patients, do you find that are you almost exclusively looking at electroacupuncture now, or do you do like just regular needle work as well?
Actually, what I do is I use the electroacupuncture for two purposes. One of them is to basically restore the chi to the body because people get sick and stay sick because their battery is low. This is, one of our colleague, Dr. Tennant's basic ideas. And I totally agree with that. So, the body is a perfect machine that should be able to self-regulate and restore itself, and it doesn't because of, number one, low battery charge, which is no chi, and secondly because of toxins, and that's a whole nother thing. But so I'm very interested in using simple acupuncture protocols to boost the battery, and it would be, the simplest acupuncture points that every beginning acupuncturist knows. And then what I do is I use ear acupuncture to really target anatomical problems or to target brain regions or to target, neurotransmitters or endocrine or whatever the focus is, because I practice fairly sophisticated German auriculotherapy. But the other thing with the electroacupuncture that's really important is the ability to use different frequencies because I'm very interested in specific frequencies for specific purposes. And I might have a slightly different viewpoint in the bigger sense of the word um, than just what the Avazzias offer. But I do use the Avazzias a lot, mainly because of their high voltage.
Mhm.
That's the main thing.
Yes, and high voltage is a term I always am cautious about explaining it because people think high voltage is danger,
I
and
know how to explain it.
yeah, go
You want
right
to hear
ahead.
me?
Yeah.
Okay, here's what I tell my patients. So this battery is powering electrons, and the electrons are flowing through the needle into your body. And if we had a low voltage machine with high amperage, which is high output, that's like a big hose, a big wide hose, and compared to the tiny hose that I'm sending electrons through. So what I do with Rob's machines is he gives me what's basically a very high kilo ohm resistor. So I'm stepping down the current, and then I actually add more resistors on the wires between the machine and the needles. And so the current is like electrons coming out of a tiny hole, but they have a lot of power because they have a big battery pushing them. And so what they have is a lot of watts. So, and I like to use the word amperage instead of current because then we have to think about physics 101, and current is just scary. So,
Yes.
they always say current kills. So we use a very, very low current, very high wattage, and that is the most easy way to affect change in the system.
Right. It's like I try to describe to people like, the difference between putting the device on your body and sticking a fork in the plug in the wall is like
Exactly.
1,000 to 1,000,000 times more
Of
electricity depending
course.
on where you are.
Yeah.
And you're right, it is that concept of amperage versus voltage. So
Right.
really you could have as much voltage as you want pushing this stuff into your system, but if the current's low, it is safe. It's just allowing you to access more of the body. One thing we talk about, and you're aware of this as well. Like we talk about acupuncture, meridians, very minorly. Like I did some minor training on it when I was doing my naturopathic training, and my dad has worked with people that are acupuncturists before, so we kind of have like a baseline. But we certainly don't go with the needle route or any of that stuff. But we do talk a lot about meridians. And so I find there's a disconnect with a lot of people. I think it's part of a Western medicine perspective where people don't really know how to understand or describe meridians. So, how when you are faced with a new patient, if you were to be asked to describe meridians, how would you do that? Like, how would you break it down so that someone can understand
Well, the first thing is I never talk to patients about meridians.
it?
But since a lot of the people listening to this may be practitioners or patients, here's how I think about it. In ancient China, they were scientists and they were describing things that they observed. And And it was just that the language that they used, we have a hard time connecting to our language for science. And so the way that I think about meridians, and I think science has actually shown this, is that these are sort of like panels of fascia, connective tissue that run through under the skin and through the muscles that are where electrons flow more easily than the surrounding area. Now, fascia permeates every single cell of the body. We know the interstitium is a giant, interconnected web. And that's, in Chinese medicine, they call that the collaterals.
Mm.
But the primary meridians, the 12 primary meridians, basically describe like the front of the body, the sides of the body, the back of the body. There's 3 on the inside of the arm, 3 on the outside of the arm, 3 on the inside of the leg, 3 on the outside of the leg. So we can basically describe the location of any pain in the body. And the way that I think about what my task is I want to improve the flow of electrons through the area where the pain is. And that is going to help with the body healing itself. It's going to reduce inflammation, all the things that we want to generate. And so one of the many ways that I think about using electroacupuncture is to run electrons through the area. And what I believe is that electrons flow only in one direction along the so-called meridian. They flow from the lowest number to the highest. So, that means they flow from stomach 1 to stomach 36 and not in the other direction. So I like to put electrons above where the problem is. And, because I'm only going to use 4 needles with each patient. So I've got to be very particular. Sometimes I use 6 on the body, but not a lot more. So that's my basic view. Yeah, we're going to try to make that pathway through the fascia work better.
Right.
Priming it, you might say.
So when people see on TV, like, acupuncture happening and there's like 100 needles in a person, is that actually a real possible? I know obviously not with what you do, but like from people in traditional acupuncture, is that pretty common?
Oh yeah, I've done it. I mean, it's not very hard to put 50 or 60 needles in a person. Okay. And the fact of the matter is acupuncture without needles can really be helpful for a lot of reasons that we finally understand scientifically. When you put a needle in the body, there's a whole lot of chemical reactions that happen, physiological reactions that happen, all of which are healthy. Okay. A needle only promotes homeostasis. If there's pain and we put a needle near it, it's going to help the pain get better. But that's not necessarily a lasting effect. And, I think we need to think along the lines of prevention, which is not how patients are thinking. Patients just say, stop my pain. Well, we're looking at how you ever got here and looking at those mechanisms and how we can steer the physiology in a better direction.
Right. So when you're using electroacupuncture, you're charging those cells back up. You're giving them the energy they need to essentially resist disease states and resist getting worse over time, as well as helping treat the underlying issue then.
Well, I think of it a little bit differently, which is that, the body is a set of batteries and I'm restoring the function of those batteries so that the body can self-regulate.
All right. So I know you work with chakras as well. When we did our presentation for the open house for the Sana Institute, you talked about chakras. They're almost an Ayurvedic concept. Like, how do they differ? How do they factor into what you do? Is it something you actually utilize in your practice?
I have no interest in the chakras, except that I think that they are the same structure as the organ concepts. So, as I understand it, the thing that is called the throat chakra corresponds to the metal element, lung and large intestine. The heart chakra corresponds to heart and small intestine, and the solar plexus corresponds to stomach and spleen. And if you think about the solar plexus, it's also where the celiac plexus is located. So these are neuroendocrine nodes. So I actually think of them as neuroendocrine nodes, and so to me, those are the same as the so-called organs of Chinese medicine, which are my batteries that make this thing work. And the reason I'm interested in that is because I use those locations to evaluate the body.
Oh, so you use them to evaluate the body more than anything else?
Yeah, I don't put any needles in those points. I mean, every acupuncturist knows the points I'm talking about. Yeah. I mean,
Okay.
it's the big ones: CV22, CV17, CV12, CV4, CV1, CV2. Yeah.
So when you're talking about, so let's just rewind a little bit to this idea of the cells as batteries. There's this idea of getting this like right amount of electricity they need. Is there such thing as too much energy that they can get? And if so,
No.
no? Okay. So there's
No. So a battery, a cell battery, is either in the right frame. It's either in the right range of charge, which is between 20 and 30 negative millivolts, or it is insufficiently charged. So anything below 20 negative millivolts is what we think of as an undercharged system. And then if it's above 30 millivolts, that is not too much electrons. What that is a system that is requesting voltage. It's requesting the resource that electrons are because it's in a self-restoration process. So if I injure myself and I have a wound, the body will bring charge to it to facilitate wound healing. And it's been measured that the charge in that local area can be as much as negative 40 or negative 50 millivolts. And so that's not really too much charge because the body's just always, moving charge around according to what's needed. But an undercharged battery, I've frequently seen patients. I have a 350-pound patient who's on 25 medications and she's living with cancer, and her voltages are always, 10 and 15, negative 10 and 15 millivolts in all of her systems because she's just so sick,
right.
So that's hopefully that answers the question.
Yeah, it does. And I think, there's this concept. I know you utilize our scalar tool as well. And
I do.
that is a lot to do with polarity, correct?
Well, the way that I use it, I'm going to tell you what I tell my patients. So I tell my patients the first way that scalar accelerates acupuncture function is that it takes away your body's interference with the message that I'm trying to send. So we know that the biology, goes in these little patterns, and sometimes you can get a pain pattern, as we know, that just gets switched on and keeps going even past the time it's necessary. But there's a lot of other biology that just kind of gets stuck, pathological stuff that just keeps going beyond the time that it's relevant. And so the scalar will eliminate that, at least as long as you have it shining there. So, for example, if I have needles in somebody's low back and I'm working on their spinal nerves and I'm trying to put electricity into the spinal nerves, and, there's a very easy way to do that, I'll shine the scalar on that segment of the spine, and that makes it work much better. But now back to the polarity issue. When one of these nodes is if I were to measure it, it would show too many electrons, but actually it's in a positive state. If I measure it with a pendulum instead of just measuring, you can use your high level device for measuring off the skin, right?
Correct.
So if I get a really high reading, I don't know whether that's negative or positive. That's the problem. And so I can only tell by holding a pendulum over that node and seeing which way it spins. And the thing is that if all those nodes are not spinning in the negative, which is the healthy direction, then that node will not accept input.
Mm-hmm.
And so I need to make all those chakras spin in the proper direction, which is clockwise, which means a negative charge. And I do that by shining the scalar device on the point that we all know, by way do 20, because this is the 100 meetings point. This point on the top of the head connects with every meridian in the entire body. And so I just set the scalar device on above their head, so it's shining right on that point. And we've timed it, how long it takes the pendulum to reverse spin, and it really only takes like a minute.
Wow.
So, yeah. And I actually have another scalar device that I use in addition to yours. And so, I've been experimenting with different scalar devices, but I love yours. It's awesome. It just switches off pain like nothing else.
It's one of those things when we first got the scalar device, I remember looking at it and my dad and I were like, what does this even do? Like
Exactly.
but it's scalar is one of those things that just continues to surprise, like in the way it can affect the body. So
Yes.
So, would you be able to share a few kind of success stories and just talk about what you've seen some of these really bad cases be turned
Oh yeah.
around with
I have a great
electroacupuncture?
I have a great success story that's recent. I have a retired commercial pilot who came to me for what is essentially pseudo gout.
Mm,
It's a strange kind of mineral that has collected in his knee, and his knee would only bend, well, certainly not full range of motion. And of course, it was also painful. It wasn't visibly swollen, and so it was almost like, well, I don't know why it doesn't bend because I can't see anything and I haven't seen an x-ray. But what I did with him was I just did my classic knee pain prescription, which is 1 point proximal to the medial kneecap, 1 point distal to the lateral kneecap. That's stomach 36 and spleen 10. And then I put a needle in either of the knee eyes, which are those holes kind of distal to the patella. And so I ran basically four needles hooked on the Avazzia, and I used the fMRSI
mhm.
frequency, which is such a beautiful thing to use. I use fMRSI on all my joint pain, and I don't think I ever told you that, Rob. And then I just shown the scalar device on the knee for about 2 minutes while this is running, and I'll run the Avazzia on there for. We usually do 20 minutes.
Yeah.
And after about 4 sessions, he's regained full range of motion.
Wow.
So that was really cool. Now this guy's a vegan, and he's not overweight and he doesn't take any medicine, so his body responded quickly. But that was so impressive. Another I don't know if I can. I'll give you another case. I have a patient who came with profound displacement of her L5 vertebra relative to L4. So both on the side view and on the anterior view X-ray, you look at this spine and you think, oh my God, this woman really needs a fusion, but she's afraid of surgery. And so what I've been doing is putting needles very close to her spinous processes at L4, L5, and S1, and I'm building this little sort of system where I'm going to insert electrons to the spinal nerves. So I got 6 needles, but I'm crossing 2 of them. So we're going to clip our alligator clip onto 2 needles. So I basically have just 4 inputs. And in that case, I've been using the 77 hertz
Mhm, mhm.
because this is a frequency. So this woman has bilateral sciatica, profound sciatica, can barely walk. And so after now with her, it's been 20 sessions. And we do the same thing. I use the Avazzia. Now the Avazzia that I have that has the red dongle, I can turn that thing up to 100% and they feel nothing, which is so cool. Yeah, I mean, I should measure the current output, but I just never have. And so that woman, after 20 sessions, no more sciatica,
Wow.
and she would have to have surgery. Now I don't know, how long that effect is going to last. We just reached number 20 last week. So, I treat lumbar spinal pathology and that kind of pain a lot. And so I would say, 50% of what I do is just the kind of thing that I explained. And sometimes I'll use 2 machines if I want to do 8 needles along the spine or 2 segments. Maybe I'll do C6, 7, and then a lumbar segment as well. So I might use 2 Avazzias. And I always use the Avazzias on different frequencies.
Right.
So I love the 77. And then I think you have a 34 hertz or so.
Yeah, it's the
30.
32 to 45. It's in
Yeah,
that
yeah.
range. Yeah.
Right. And so I'll use those 2 frequencies. And what happens is the frequencies interfere, right? And the interference between the frequencies generates a whole bunch more frequencies. Or I'll have one of the machines on blue and the other one on a selected frequency. Another kind of application that I use, and it's not a case study as much as just an application, is if we have some scar tissue. Oh no, I have that great case of that non-healing wound. Let me tell you that one. So we had this woman about 23 years old who was climbing on a train car, and it happened to move at just the right moment, and her leg was crushed, and so she was amputated at the knee. And she came with a non-healing wound on her stump that was about, gosh, it was probably 5 inches in diameter. And they couldn't fit her for a prosthesis until that wound closed. And it had just been forever. And so what we did was we actually put needles all the way around the edge of that wound. We put one needle every 1/4 inch. Wow. And we hooked up 4 Avazzias, and we ran them all at different frequencies. And I think we were treating her twice a week. And at first, it wasn't very clear what was happening, but pretty soon, the skin grew back so fast that at the wound clinic, the nurse said, "Stop what you're doing," because the skin was starting to curl under and they had to pack it. So, that was just probably one of my very favorite success stories. And, I know that without what we did, that young woman would never have gotten to where she's gotten today. So I think, I have some other high voltage stimulators, but not as high as this. And so, the Avazzia is my tool for the big problem situations.
Right. Bring in the big guns when you need them, right?
That's right.
Awesome. All right. Well, Laura, thank you so much for joining me today. This was awesome. Very unique perspective. Like, I know there's a lot of acupuncturists out there that do this, but not as many as there are acupuncturists, right? So I think a lot of people are like, that. You need to get more people on board with this. This is the
right. Well, and this is really what we need. And I'm currently developing a series of introductory courses to help acupuncturists understand what I do and kind of have a higher level of application than the usual electroacupuncture.
Awesome.
I'm easy to find on the internet.
Yes, and we're gonna actually include all of your info in the show notes. So anyone that's listening to the podcast here, you'll be able to find Dr. Laura's things right below the episode. So again, thank you. Again, this was amazing.
Okay, thank you for having me.
All right, everyone. Until next time, I'm Dr. Rob Vanbergen, and you're listening to Pain Free for Life.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.